Hi everyone, Dr. Sam Gaston here with North Texas Sport and Spine, continuing our February series on common baseball injuries. First video we focused on rotator cuff strains, second video we got to hamstring strains, and today we're going to focus on another soft tissue injury, and that's going to be the oblique strains. As you're seeing with baseball players, soft tissue injuries are a common injury, and a lot of times it's because there's just so much overuse and repetition, and they're trying to generate max force, both with pitching, trying to throw as fast as possible, and hitting, trying to generate as much power as possible. So we've got our internal and external oblique, and there's also the transverse abdominis going across through there, but that's not one of the obliques, it's just another important core muscle in there. With the external oblique, it's going to attach at ribs 5 down to ribs 12, and it's also going to come across to the xiphoid process, down to the pubic bone, and out a little bit to the iliac crest as well. Internal oblique is going to run perpendicular to that underneath. Obviously it's deeper, it's internal, and the other one's external. It's going to attach at the inguinal ligament up to the iliac crest, and then that's going to come across to ribs 10 through 12. The internal oblique is the most common injury or strain in baseball players, just due to the force generation and how much rotational force is in both pitching and in hitting. So both of these muscles are going to combine to be very important in the throwing phase. They're rotational muscles, they travel oblique, so anything that has to do with rotation, you're going to get a lot of use out of those obliques. They are really important in the force transfer from the hip up to the upper torso and then in through the shoulder, obviously. So that's going to be really important in throwing, really important in hitting as well, because they both are heavy rotational activities. There's also going to be a lot of use in deceleration. Again, if you're contracting on one side, rotating one direction, you're stretching, elongating, and you're going to need both of those muscles to decelerate on both sides there. The opposite side oblique is usually the one that's going to be injured, both in hitting and in throwing. In the throwing phase, the opposite side one is stretching, and load up, it's going to be eccentrically stretching, and then as you're following through, it's concentrically stretching, it's tightening up, and that a lot of times leads to injuries on that front side. Same thing with hitting. The front side is under a lot of tension as you're loading up, a lot of eccentric stretch as we're coming backward, and then contracting all the way through. So the lead oblique is usually the one that gets hurt, opposite side of your throwing side. When you get this injury, it can be another sharp pain to that area. Feel it into the ribs sometimes. It's going to be commonly painful with twisting, bending, coughing, breathing. You'll even feel it. Sometimes there can be a pop there again. Sometimes there can be a bruise because this is a tear in the muscle to some extent. Treatment-wise for this, you could theoretically dry needle it. I don't like to put needles anywhere that I can't back it up with a bone behind it, just because we want to minimize risk as much as possible to the soft tissue, to the lungs in there. Resting is going to be important because, again, it's a muscle. Anytime we're using it, you're potentially risking further irritation of it. Some light stretching to tolerance until the pain level goes down, and then rehab obviously is going to be important for this. Just like every other soft tissue muscle injury, we have to get it stronger once it's recovered some. In terms of recovery time, again, with all of these, it depends on the grade of the actual strain. Some of them can last for a couple days, up to a couple weeks, and then again, if we're up to a grade 3 where we've got almost a complete tear in that muscle, you're looking at months out on this one. This is one you see on the injury report a lot, and it just tends to linger because everything you do in baseball has that rotation in there. It's really easy to re-injure these oblique muscles, and so these injuries can linger. Tune in next week as we get into some deeper, more baseball-specific injuries that are less common in the everyday population.